Dr. Jameson has been probably the best doctor I think I've ever seen. She is the first doctor who actually wanted to... I'm sorry, I'm probably gonna start crying. Hi, I'm Taylor. I grew up in California and I've moved all over for school. I have a golden retriever who's my child at the moment. I've played soccer ever since I can remember. I started probably when I was about 4 years old, and I ended up getting a full ride to play soccer out in college in Missouri. So I have complex regional pain syndrome. Mine occurred from a nerve injury when I had surgery on both my legs. Trying to play through the pain was, that was a huge part of my life, but it got miserable. It'd be exhausting by the end of the day. I could barely make it through a soccer practice without having to be carried off the field.
Taylor is one of those patients who really leaves a mark on you. She had been through so much to treat her complex regional pain syndrome. When I met her, she told me the story of how she got her injury playing college soccer. I could immediately relate to her in that I played college soccer as well. I know how much that is a part of your life, and when that's taken away from you at such a young age, it's really hard. And then my role in her care was really to lay out a plan for ways that we could improve her quality of life.
Being that I wanted to be as active as possible, she was more than willing to work with the kinds of treatment options that would be able to give me those goals. So I had been on oral medications as long as I could remember to try and treat the pain, and they were successful to a point. And knowing that those worked, we wanted a more direct route, and she had mentioned the pain pump.
Complex regional pain syndrome is a very complicated syndrome of pain in an extremity typically. It can come after a trauma or it can be spontaneous. We have blocks that we can typically do early on in the process. We can do things like spinal cord stimulation, which can be very helpful. And then we can do things like an intrathecal pain pump, which is what we've done for Taylor. The beauty of that therapy is that you get to try that out. We put a little bit of medication in your spine and you go about your day and see how much improvement you notice. And when Taylor came back from that, she had significant improvement and was quite hopeful. And so we ended up putting that intrathecal pain pump in.
Within, I think, 24 hours from being filled with that medication, I felt a huge difference. It was a complete 180 from how the pain had been for years. Dr. Jameson has been probably the best doctor I think I've ever seen. She was one of the first doctors who actually listened to what I had to say, and I might have been one of those crazy patients who walked in with a list of all these treatment options, but for her to make me feel so comfortable in her office and not dread coming to appointments like I had in the past. I think it'll be a lot of fun to play with Dr. Jameson. It'll be a huge positive for me, especially knowing where I was at when I first came into the office, and being able to leave by going out and kicking the ball around with Dr. Jameson will be a special experience.